Thanks, Ashley. Well, we know that COVID-19 may cause heart damage in patients with severe cases of the disease, but a big question remains, does cardiac injury occur in patients who are asymptomatic or only have mild symptoms? Joining us now to talk about this is Dr. Paul Thompson, Chief of Cardiology Emeritus at Hartford Hospital. Doctor, welcome.
Thank you for having me.
Thanks for being here. So we've heard reports on the COVID's effect on the heart, but what are the particular concerns for athletes?
The particular concern for athletes is that if you get a heart infection, an inflammation from the virus actually enters the heart, that can cause what we call cardiac arrhythmias, in other words, abnormal heart rhythms. And it's actually been associated with cardiac complications during exercise. So I was part of a group from the American College of Cardiology, the sports and exercise subgroup of the American College of Cardiology, and we came out with some guidelines for how you deal with athletes. And the take-home message is that if you have either no symptoms or very mild symptoms, you can return to participation without having to do a lot of studies. And so it's really guidance for physicians, guidance for clinicians as to how they should advise athletes who want to return to competition.
Interesting. All right, so your group observed athletes who had COVID, and what specifically did you find?
Well, specifically we found that if the athlete either was asymptomatic, in other words, tested positive solely on a nasal swab but had no symptoms, or had very mild symptoms, the observations are that those kids do just fine. On the far other side are those patients who are admitted to the hospital, because we found that about 20% of patients that actually get admitted have evidence from blood enzymes of cardiac damage. So that if you've been admitted, and especially if you've had evidence of cardiac damage when you've been in the hospital, then you have to be very careful in returning to exercise, and you need some sophisticated testing. And then in the middle is that group that had kind of moderate symptoms. They may not have been admitted to the hospital, but they had a severe fever. They had terrible body aches. They were quite sick. Those people really need to check in with a clinician. Now, why did we issue these guidances, this guidance? That's because nearly all athletes were not being allowed cardiac injury before they had seen a clinician, a doctor, and the medical staff of these universities and these athletic facilities were simply being overwhelmed.
All right, doctor, real quick last question. What should athletes be watching for? Signs or symptoms of a serious problem?
They should be watching for how they feel. If they feel good, they've had a mild case of the disease, even if they're positive, once they've quarantined and wearing a mask and all of that, they can return to participation without, and their physician can let them return to participation. Their athletic trainer can let them return to participation without a lot of concern.
All right, Dr. Paul Thompson, thank you very much for joining us, and keep up the research.
Thanks for having me.